Hello and welcome to Connect to Healthier Live. I'm Hartford Healthcare's Tina Verona, and we thank you for joining us. Well, it's a condition that can be painful and often embarrassing for women to talk about. Because of that, women choose to just simply live with it. We're talking about vaginal dryness. Dr. LaSala is a Uro-gynecologist right here at Hartford Hospital. Good afternoon, Dr. LaSala.
Good afternoon, Tina. I'm glad to be here.
Well, yeah, thank you so much for joining us. I know this is a topic that you are so passionate about, and rightfully so, because it's a condition that's treatable with laser technology called the FemTouch. Tell us what it is. How does it work?
So what happens as a woman goes through menopause, around the menopausal time, the vaginal walls just kind of dry up, they kind of shrink a little bit, and sexual function suffers. So women have pain with sexual relations, and they can use lubricants, they can try things like that, and sometimes it helps, but not all the time. So what the laser therapy does, it's really kind of neat. The light beams from the laser go in the vagina. So it's a probe that goes in the vagina, kind of like a speculum. And it goes into the vagina. It does not hurt. The patients are comfortable. They're talking with me as we do it. It's not painful at all. And the laser beams hit the lining of the vagina. And the way it works is it allows for increased blood supply to the vaginal lining. And it actually induces new cellular growth. The cells that allow the vaginal lining to be nice and spongy rather than, dry and flat. So it under the microscope, you can see these changes. The blood supply comes forward, and the cells get thicker and spongier, and it really works. So it works on making that vaginal lining healthy again. It brings the acidic environment back to the vagina, because the vagina is supposed to be acidic.
Right.
All of these things allow that vagina to be young again.
Now, this is a condition that can happen to women who are breastfeeding, but primarily postmenopausal women. But some women can go through menopause as early as the age of 45.
Correct.
Right?
Correct. So the aging effect, and it's mostly estrogen deficiency, which starts when we start going through the menopause at around age 45. Our estrogen levels are dropping. The official menopause oftentimes happens at age 51. And official menopause is the lack of periods for 12 months. But the symptoms are starting way before that. So the longer the vaginal environment is without estrogen, these changes inevitably happen. Breastfeeding is associated with estrogen reduction. So the vaginal health in a woman who's breastfeeding is similar to that as a postmenopausal woman. As soon as she stops breastfeeding, everything returns back to normal. But we really recommend the laser therapy for the perimenopausal, postmenopausal woman.
To have the most benefit.
To have the most benefit. And that's where the studies are.
We do have an anonymous question that we received online, and this writer asks, I did not have painful sex, but when I went through menopause, I lost all desire to have sex at all. Does your laser procedure only work for dryness and pain? And is there anything available to let me have a desire to at least want to enjoy sex again? And here, we were just talking about this. This particular woman went through early menopause at 49. Now she's 62.
Yes. So that's an excellent question, and it's amazingly common problem. 40% of us, 40% of women will have some kind of problem with sexual relations, whether it's desire, whether it's not being able to climax, whether it's pain, 40% of us. So that's how common it is. So the laser therapy is really, it's a localized therapy to the vagina. So it doesn't do anything for the psychological well-being of, feeling sexy or having sexual thoughts or desire. That's really more of an endocrinological condition and a psychological condition to be ready for sexual relations. We find that in women who have pain with sex that comes along with menopause, they don't want to have sex. it's not comfortable. They're dry, they feel itchy, you know, maybe they feel like they have more of an odor, so they're not feeling sensual or sexual, and then reflexively in their minds, they don't really want to engage.
Right.
So the vaginal laser therapy makes that all better, and then hence makes the psychological feeling better. But the laser therapy in and of itself is not going to really change the desire.
Now, this is a topic, of course, that is uncomfortable for many women to talk about, and especially to seek treatment. It's something that you're passionate about, as we said, but you're very comfortable talking about this and letting it be known that you've actually had this specific treatment.
Yes, so it does. It comes from the heart. I wear my heart on my sleeve. So we know that for men, Viagra and Cialis and those kind of medications have really done a great job helping men, and that's good. That's good. But now we're the partners. So now our male partners are ready, and it hurts for us. So that's not really fair. And there are some women who, estrogen vaginal cream is the number one treatment for vaginal dryness and pain with sexual relations. It works, it's effective. But there are some women who can't use it. Either they've had a history of breast cancer or cancers, pelvic cancers, or a history of clots, or some medical reason, or they really just don't want to use estrogen vaginal cream. So those poor women are kind of out of luck because nothing else is really that effective. You know, the vaginal jellies and the lubricants help, but they kind of get to a certain point where they still kind of dry up.
It's not a long-term
and
solution.
It's not a long-term solution. Yeah. So, I mean, we always advocate the medical treatments first, the estrogen vaginal cream, the lubricants.
Right.
But when that...
The conservative methods.
The conservative methods. And when that doesn't cut it, at least we have this answer. So, you know, here I am having gone through the menopause at a young age and saying, you know what, ow. This is not pleasant, and I don't want to give that part of my relationship up. I'm still young, so and I have contraindication for using estrogen. So when this therapy came out, when it first came out, I kind of thought, oh great, there's something else to make us women feel badly about ourselves. So that was like my first response. And then as the data started coming out on it, and then as I'm talking with my colleagues who are using this on women and seeing this dramatic improvement, I said, all right, I'm on board with this.
Right.
So I tried it. I said, for many things I offer my patients, I try myself. For many of the things, I won't electively, voluntarily have surgery, but for many of the things I try myself. And it was like, yes, there is something. There is something.
That's a big deal for women.
And that's a big deal.
Yeah, absolutely. What was your recovery like?
Nothing. So it was great. My nurse practitioner did it. A physician doesn't need to do it. A nurse practitioner can do it. And it was painless. The worst part about it is just like getting the speculum inserted, getting the vaginal probe inserted for the laser, you don't feel anything. And you're sitting there going, you're hearing the beep of the laser, but it's not uncomfortable. And then as it gets towards the skin, then you kind of feel it happening. If anybody's had laser hair removal, it feels a little pinchy. And that's it. And you go home, and that's it.
Resume your normal activities.
And you resume your normal activities.
How many treatments?
So the data in the literature, and this is what we're advocating, because this is what the literature states, is it's 3 treatments about 4 to 6 weeks apart. So about 7 out of 10 women after the first treatment will notice some improvement. Great, but it's really after the 3rd treatment that 7 out of 10 women will say, I was not able to have sexual relations, or it really, really hurt, and now I can, and I can enjoy it. So, you know, so it's not necessarily a cure-all, but it's life-changing.
Yeah.
And when in our experience, for our patients, it's been life-changing. So, you know, and then there are some that it really isn't effective, or a little bit effective. Nobody's been harmed. There's no adverse effects from it. So it's safe. You know, the vaginal laser has been used for other indications, so it's not experimental. It's just now newly being used in the last maybe 3 years or so for vaginal dryness, vaginal pain, and it's also been shown to reduce like urinary urgency, and it kind of burns when I urinate. Not really so much incontinence. The data on that, it's still new, so we don't have really data on incontinence yet. But just irritative voiding, urgency, you know, it burns when I pee. So it's also been shown to significantly improve those symptoms as well.
So it just sounds like a lot of discomfort issues.
Yes, we're not supposed to be uncomfortable here.
Right, and you shouldn't live with that. I think
Correct.
It's so key. We have another anonymous question online. Does the FemTouch laser therapy work for women who have had a hysterectomy? That's a great
Absolutely, absolutely. And depending on why she had the hysterectomy, or if she just had the hysterectomy, if her ovaries are in or ovaries are out, it works. It's effective. It can be used on a post-hysterectomy patient. So yes, and it's effective.
Popular question we're seeing on Facebook right now, of course, is this covered by insurance? That's the million-dollar question.
Million-dollar question.
No pun intended.
And no, it's not. And I don't know if it's because the insurance companies think that this is cosmetic, because it's not.
Right.
I mean, yes, laser therapy is used for cosmetic reasons. This is not a cosmetic reason. But they're not covering it.
And we do want to differentiate that, because you see these reality shows where they talk about vaginal rejuvenation, and this is not the same as that.
Correct.
So I want to make sure that the audience understands the difference between the two.
Yes, that's
that this
excellent.
is not, that's cosmetic, this is not cosmetic.
Correct.
Explain
this is
the
not
difference.
Cosmetic. That's an excellent question. I'm glad you brought it up. So, so cosmetic therapy for women who feel that their labia are too big, or that their vaginal opening is too wide and they want their labia reduced, or their vaginal opening tightened, that's a whole separate thing. And the laser therapy is not intended to do any of that. It's not intended to tighten me up. Kegel exercises can do that. This indication is really for vaginal dryness, pain with sex, irritative urinary symptoms. You know, not the mommy makeover. Maybe at some point it'll be studied, and maybe that will pan out, but that's not been studied now, and that's not our indication for it.
We have another question. How does chemotherapy affect the body if you have had that type of treatment?
So that's a good point. And depending on the type of chemotherapy that's used, especially in women who've had breast cancer or uterine cancer, because those are really anti-estrogen types of chemo, it can really wreak havoc on the vaginal tissues and the bladder. It's an option to be used in women who have suffered from that and who have been on chemo, but again, not for the libido. It's really just for the local therapy.
Treating the symptoms.
Treating the symptoms.
Yeah. So how long, if you're in post-menopause, you've gone through menopause, how soon or how quickly can a vaginal dryness occur?
90 days.
Really? 90
It can.
days, wow.
The changes begin at 90 days. So, but the good
you
thing
could start
is,
seeing symptoms
you can start
as
seeing,
early as 90 days.
Correct. But the good thing is if a woman elected to use some vaginal estrogen cream, the benefits start 90 days after. So, but yeah, that's how long it takes for the symptoms of estrogen deficiency to have on the vagina and on the bladder.
And you know, we talk about this, that women obviously choose to live with this, which they shouldn't, but if they do and they're not comfortable coming forward, what can happen? Can this eventually leak? Can it become dangerous? What can eventually happen?
That's a good question. Generally not. You know, thankfully it doesn't become dangerous, but the impact can really be big. you know, I have a lot of my patients who have such pain with sexual relations, and they'll say to me, well, my husband's so understanding, and that's beautiful and that's wonderful. But are some people straying?
Right, right. Yeah,
Because
good
I've had
point.
patients whose partners have strayed. So, and that's just not fair, and there's a whole other, you know, stuff about that in the background.
Right.
You know, and some women don't want to have sexual relations, and they're okay with that. And that's okay. That's not negative if they're okay with it.
Sure, sure. Lucille on Facebook asks, can this be a replacement for estrus cream for dryness and frequent
Yes.
UTIs?
So my initial first line for vaginal dryness and recurrent urinary tract infections is estrogen vaginal cream, because we know that the reason they have vaginal dryness and the reason they have recurrent urinary tract infections is because they're estrogen deficient. So my first go-to is vaginal estrogen cream. The systemic, the oral estrogen or the estrogen patches really isn't enough. We need it there. We need it locally. But again, if a patient chooses not to want to use the vaginal estrogen or can't use estrogen, the laser therapy is great. There's studies going on now with the laser therapy for preventing urinary tract infections. Again, it's kind of the same mechanism. It's keeping the vaginal lining thick and acidic that helps ward off bladder infections. So there's studies being done on the laser therapy for urinary tract infections, but we're not yet ready for prime time for that.
Yeah. So if you want to send us a question anonymously, we do have an email address for you to connect with us, and that is, of course, connecttohealthier.com, or you can just write us directly on Facebook. We do have another question. What are the barriers to this? Why aren't people doing it?
So the barriers is cost. It's not inexpensive. And, you know, when I'm thinking about this, obviously I'm a working woman, so I'm in a different, you know, situation than others. And if I could, you know, get this to be paid for, but so far the doors are slamming in my face. So, but I don't give up easily. So it's cost, because time, no.
Right.
Recovery,
no.
It's 7 minutes. Recovery, no. You know, if it's 3 sessions, 4 to 6 weeks apart, by 3 or 4 months, 4 months' time, the impact on your life is dramatic.
Yeah.
So
that's when you say to yourself, it's how can you put a price tag on that?
Right.
On your
Right.
well-being, but your relationships and your overall peace of mind, right?
Right. So that's a tough thing, and I don't foresee coverage anytime soon.
Are there any myths or misconceptions out there that you sort of want to dispel about the laser, about this technology, about anything at all associated with this treatment?
So that's a good question. So the laser therapy is not FDA approved for vaginal dryness, or what we call the fancy terms, GSM, genitourinary syndrome of menopause. That's vaginal dryness, itchy, you know, you feel like you have an odor, burns when I void, urgency. That's genitourinary syndrome of menopause, and that's a real diagnosis. That's real. So the laser therapy has been used vaginally and on the labia externally for years to manage problems with condyloma, with other conditions of the vagina and the vulva. So it's FDA approved for that. So we know it's safe. Obviously, we would not be doing this if we didn't know it was safe. But it's not FDA approved yet for the indication of genitourinary syndrome of menopause. So that's one thing. We're working on getting it FDA approved. But the other misconception, again, this is not the mommy makeover.
Right.
This is not going to, you know, take a woman who's had 3 vaginal deliveries and make her look like she did when she was 19.
Is there an age limit as to, if a woman reaches a certain age, she can't have the laser?
No, there's no contraindications per se, except some women who are older, if their vaginal walls have really dried up and shrunk, the probe for the laser can be uncomfortable inserting it. There's going to be a smaller probe available, hopefully soon, to help with those women. So, but no real contraindications. I mean, if you have an active vaginal cancer, that's a no-no. But,
right.
you know, but part of the evaluation is we do the exam and we look and see just to make sure the woman's a candidate for it.
Right.
And
what would make her a candidate for it? What are you looking for specifically?
So we're looking for the vaginal lining should be nice and pink and moist, and we call them rugae, but they're wrinkles in the vagina, kind of like a sponge. And if that's all absent, she's like the perfect candidate for it. Mm-hmm. She can't have a large prolapse, so her uterus can't be really prolapsing, bulging down. Her bladder can't be really bulging down, only because it's not been studied in those patients. Right. Mm-hmm. So.
All right. Well, we thank you for joining us for, actually, we do have one more question. Lucille on Facebook is asking, how much does this cost? That's always the follow-up question.
Yes, that's always the follow-up question. So it's expensive. It's $1,000 per treatment, and we usually say 3 treatments are needed. Mm-hmm. You know, because I'm obviously so excited about this, I asked, can we reduce the price a little bit? So they're willing to give me a special. So we're doing $800 a treatment. And then what happens is, so it's the 3 treatments. You don't have to have the 3 treatments, but we feel that to have the benefit, it's really 3 treatments. And then the data in the literature is showing that by 12 to 18 months later, women's symptoms start kind of reverting back. Mm-hmm. And it makes sense, because unless there's estrogen around, they're going to revert back. Right. So then we feel that, you know, if she's done the treatments and has benefit from it, then the follow-up treatments would be less, like $500.
So take us through the process. A woman comes in, you do the evaluation, and it's treatment day. What can she expect?
So what we would do for the consult is the equipment's extraordinarily expensive, so we only have it in one office, and it's not portable. It's a laser, so we're not taking it around to the offices. So, you know, we do our discussion, we do our exam to make sure that she'll benefit from this. And if she wants to right then and there, you know, we'll have the equipment ready and sterilized, and she can have the therapy right there. She doesn't need somebody to drive her home or drive her there. And it's about 7 minutes.
And then how far apart do you
about
space
4 to
the
6
treatments?
weeks.
4 to 6 weeks.
About 4 to 6 weeks. So we'll get her scheduled. You know, if she wants to. You know, women are busy. So if she wants to get her date book out and say, let's schedule the next 2 sessions, we'll do it. Mm-hmm. Or we can just do it as she goes.
While a woman's undergoing treatment, say she's had 1 treatment and maybe she's just had the 2nd treatment and she's feeling better, can she have sex?
Yes. So the company says wait 72 hours. Mm-hmm. So that's the only limitation, is wait 72 hours.
But she can have it while she's undergoing treatment.
Absolutely.
If she can tolerate that.
Absolutely.
Question. Well, if you are just joining us, we are talking to Dr. Christine LaSala. She's a uro-gynecologist right here at Hartford Hospital. We're talking about the FemTouch laser for vaginal dryness. It is such an uncomfortable topic for women to talk about, but we are happy to see that we are getting questions and we are creating that dialogue. And I know that that's something that you would love to see, women coming forward, because this is a condition that you don't have to live with. It is highly treatable and successful, and it takes 7 minutes to do. So why not, right?
Right. And just like you said, Tina, it just engages in discussion, so that, you know, my biggest thing is I don't want anybody suffering because she
in silence.
Mm-hmm. So engage, you know, with your gynecologist, engage in the conversation, because like I said, I mean, there are answers for this. So if your doctor doesn't know, how can we help?
Right. If you're not telling them.
Right.
And also too, for postmenopausal women that are noticing some discomfort, maybe some vaginal dryness, it's a condition that's probably going to get worse, right? So is it better if they just come forward initially and to have that discussion with your doctor?
That's a good question. So if it's bothering you, yes. Yes. Because why put off sexual relations? Why get into that kind of habit where, whereas sexual relations used to be weekly or monthly or every 3 months, and now it's every 6 months, and then it's going to be every year, and you're bothered by it. So have the discussion. If you're bothered by it, why wait until it's horrible?
It's horrible, right? And I'm sure you have a lot of women that come in after that third treatment and say, I feel like I've gotten my life back, right?
Yeah. I mean, that's the neatest thing to see.
Yeah, I'm sure.
And I've had some patients who said it helped. It wasn't as dramatic as I expected, maybe because I get so excited about it, but it helped.
And I think it helps too is that you're a physician, but you're a patient too. And I think your patients can feel comfortable in that fact, knowing that, you know what, they're not just getting it from a clinician perspective, they're getting it from both.
From an
so
experience.
I think that that's important too. We have another question. Do you have to get treatment annually, and is there an upkeep?
Excellent question. So not necessarily. The data that we have show that at about 1 year to 18 months, the patient's symptoms start. Well, the 1 year outcome data, it's great. It has lasted. I think there's one study that had 18-month outcome data where the patients were starting to revert. But it would be completely up to the woman to decide.
Right.
If she's doing great, she doesn't need any more treatments.
Right. And I guess it's a case-by-case basis too. And probably
Correct.
if they were experiencing some maybe minor dryness, maybe something over the counter could help with that.
Correct. Correct. So, there are products over the counter, not just the lubricants that are used for sexual relations, but other products like Replens that keeps the moisture going a little bit longer. It lasts a couple of days.
Are there preventative methods that women can do to avoid vaginal dryness?
That's a good point. No douching. No douching. Because it just changes the whole bacterial environment. We're supposed to have bacteria in the vagina. There's good bacteria in the vagina, and douching just wipes it out.
UTIs too, right?
Yeah. So, so that would be the big thing. And if you're going to use lubricant during sexual relations, not petroleum jelly. Use the lubricants that are meant for lubrication, not petroleum jelly. One of my patients, I'm not kidding, somebody told her to use jelly. She used jelly. Like strawberry jelly. So, that she did what she was told. So,
Not a good idea.
No.
We do have another anonymous question. If you are on VagiFem and have the treatment, should you discontinue using the tablets or continue using it for a while?
That's an excellent question, and there was a randomized trial that looked at women who had estrogen, VagiFem, estrogen alone, estrogen plus the laser, and laser only. And they all did well. The women who had the laser alone and the laser with the estrogen did best. So based on that study, I would say, sure, stay on the VagiFem.
Right. Here's a question. So, menopause is essentially a depletion of estrogen. So women, will take estrogen, but then you hear, well, it could cause breast cancer. That's always the fine line there. So what do you say to that?
Yep. So what we've learned from all of these studies is that if a woman has gone through menopause, there's no reason to start estrogen to prevent heart disease or prevent osteoporosis. We know that now. The best time to use the estrogen is around the time that you're going through the menopause, and it's safe for 4 to 5 years after the menopause. After the 4 or 5 years, at that point, the cons, the risks outweigh the benefits. So estrogen is good for, the 49, 50-year-old for up to 5 years.
What do you say to women out there who might be watching us now who are experiencing vaginal dryness as a result of having gone through menopause but are still just not ready to come forward, what do you say to them? This is your opportunity.
Yeah, so good. So meet with your gynecologist. And just to make sure that there's nothing else wrong, that there's nothing else wrong, because there's vulvar skin conditions that can cause pain with sex. So meet with your gynecologist and just get evaluated. Make sure that there's nothing else going on. And it's okay. Your gynecologist, we do this. We know this. And just a simple conversation to say, okay, I'm not the only one, and maybe just some positional changes, maybe just some more behavioral things, lifestyle things can make a difference.
Can vaginal dryness be an indication of something else going on other than, let's say you haven't gone through menopause, but you are experiencing vaginal dryness?
Yes.
What can that be an indication
Yes, so
of?
it could be an infection. It could be just an imbalance of the normal vaginal ecosystem. So it could be that. It could be other disorders like lichen planus and lichen sclerosis, which are skin disorders but can present themselves vaginally and on the vulva. And that should be checked. That should be, because lichen sclerosis, for example, it slightly increases the risk for vulvar cancers. So, so especially if you're not menopausal and you're feeling dry and something's not right, get checked.
Yeah. Are these common conditions before menopause? Do you see this a lot?
Yes, lichen sclerosis and lichen planus is all age groups. More common as a woman gets older, but I've got 40-year-old patients in my practice with it.
And vaginal dryness postmenopausal, is that common too? You're seeing that a lot? And what you're seeing
Yes.
is probably magnified ×4 with women out there who have it but are not seeking treatment, right?
Exactly, because any postmenopausal woman who's not on estrogen has vaginal atrophy. That's the techie term, vaginal dryness. Whether it bothers them or not, that's a different story. But when you look at a woman who's a few years postmenopausal, that vaginal lining is pale, it's thin. I mean, we have to gob on the KY jelly just to get the speculum in.
Wow.
So, I mean, it's obviously apparent.
Are there any women out there who would not be a candidate for FemTouch laser?
So anybody who has undiagnosed vaginal bleeding, you really have to make sure that it's just vaginal dryness, that there's not a cancer there, that there's not an underlying condition. So that's really the only real contraindication.
That would prevent somebody from going in. And that would be part of the evaluation process, I would assume.
Absolutely.
And what are some of the questions that you're asking in this, that women can expect and that they should, come prepared for and know these answers before they get to their gynecologist?
Good question. So it's a quality of life issue. So how are you able to have sexual relations? Because some women will say, he can't even go there. Because that might be a different situation. Or when you have sexual relations, does it hurt going in? Does it hurt deep in? Where is it? Does it get better as you get more lubricated during intercourse, or does it not ever get better? And then we have these questionnaires, female sexual function indices, which is a validated way of determining the severity of your symptoms and how much does it bother you. And then what we'll be doing is, after the treatments, we ask the patients to redo the questionnaires so that we can sit side by side and say, this is how you were before and this is how you are now. So look at, you have had a dramatic change or not, but
Right. I think really the key takeaway here is that this is a painful, uncomfortable condition, but you don't have to live with it. There is treatment there with the FemTouch laser, and there's success, and it's life-changing, and you can live your life without that worry. I think that's key, and I think that's key for people to know that.
Yes, absolutely. And it really does help. And if it doesn't help, we're no worse for the wear. Our pocketbook's a little emptier,
Right.
but speak up.
Yeah, absolutely.
As gynecologists, I'm saying that because I'm a gynecologist.
Right.
I'm a urogynecologist, but your medical doc, you can bring it up with your medical doctor as well.
Great discussion, Dr. LaSala. I know that this is so important to you, and thank you for all of your
Thank
insight.
you.
And I hope that all of you learned something from this. It was an
Yes.
education for you. We do appreciate all of the questions that we received, even on Facebook. So it shows that women are eager to talk about this and to create that dialogue, because that is essentially the first step. So for a free consultation, you can call 1-855-HHC here. We thank you once again for joining us for this live Facebook discussion. I'm Hartford Healthcare's Tina Verona. Have a great day.